Good morning, how are you? Wish you are fine. In general, I use this kind of Botox, but if you can notice, there is only one box, Neuronox. What is botulinum toxin? Botulinum toxin is a protein produced by the bacterium Clostridium botulinum and is considered the most powerful neurotoxin ever discovered. Botulinum toxin causes botulism, a serious and life-threatening illness in humans and animals. It has been widely used not only in the cosmetic field, including facial wrinkles reduction, but also in the therapeutic areas for people with blepharoplasm, cerebral palsy, muscle spasticity. What is Neuronox? Neuronox, launched in 2004, is the first commercialized botulinum toxin on the globe. The efficacy and safety is proved to be comparable with botulinum toxin, Botox allergen in clinical studies. Neuronox has been registered in 25 countries and is in the process of registration on other 30 countries. What is glabellar frown lines? Years of squinting or frowning can cause glabellar lines, which are vertical lines between your eyebrows. As you are getting older and skin is becoming less elastic, those moderate to severe frown lines remain although your muscles are not contracting. With a few injections, Neuronox reduces the muscle activity that causes those glabellar frown lines. This reduces muscle activity and improves temporarily the appearance of moderate to severe glabellar frown lines. Good morning, how are you? Wish you are fine. In general, I use this kind of Botox. It is allergen, but sometimes I used this one, Neuronox. In some of the countries I visited, according to the composition of Neuronox, active ingredient is Clostridium botulinum toxin type A, stabilizer is human serum albumin, isotonic agent is sodium chloride. It appears as lyophilized white powder for injection in a colorless transparent vial. Indication temporary improvement of moderate to severe glabellar wrinkles associated with corrugator muscle and or procerus muscle activities in adults between the age of 18 and 65. Now it has been, the indications has been increased, and we have a lot of indication and cosmetic indications for the injection of Neuronox and other types of Botox, especially allergen use. Neuronox is indicated for the treatment of benign essential blepharospasm in patients 18 years of age and above. Neuronox is indicated for the treatment of equinus foot deformity due to spasticity in pediatric cerebral palsy patients 2 years of age and above. Muscle spasticity. Neuronox is indicated for the treatment of upper limb spasticity associated with stroke in patients 20 years of age and older. Precautions and warnings. Since the active constituents in the drugs is Clostridium botulinum toxin and neurotoxin, which is derived from Clostridium botulinum, recommended dosages and frequency of administration should be observed with a full understanding of the precautions in use. Physicians administering the drug must understand the relevant neuromuscular anatomy of the area involved and any alterations to the anatomy due to prior surgical procedures. The recommended dosage and frequency of administration for Neuronox should not be exceeded. Neuronox must not be administered to the following patients: patients with hypersensitivity reactions to any ingredients of Neuronox, patients with systemic neuromuscular junctional disorders, women who are pregnant or nursing mothers. Good morning, how are you? Wish you are fine. 3 cases I should not use Botox. Patients with hypersensitivity reactions to any ingredients of Botox, patients with systemic neuromuscular junctional disorders, women who are pregnant or nursing mothers. Good morning, how are you? Wish you are fine. Frequently asked questions. How does Neuronox or Allergan Botox work? Botulinum toxin is injected into muscles and works by blocking nerve impulses to the injected areas. This reduces muscle activity that causes facial wrinkles. When can I see results for Neuronox Botox treatment? You may see an improvement within 1 to 3 days after injection. It continue to improve, and the significant results show up 1 to 4 weeks later. The effect lasts for 3 to 6 months. Duration may differ depending on the individual and the treatment method. How long does Neuronox or Botox Allergan last? If you are satisfied with the result and want to maintain it, you would get a treatment regularly. Injections may be repeated when the effect of a previous injection has diminished, but generally no sooner than 20 weeks. The best time should be consulted with the doctor. What are the possible side effects of Neuronox treatment? The most common side effects are weakness of muscle and appearance of a bruise at the injected sites. These side effects slowly diminish within 6 weeks after injection, maybe less than 6 weeks. Other common side effects in clinical trials of botulinum toxin treatment are headache, flu syndrome, eyelid drooping and nausea. A thorough understanding of facial muscle anatomy and proper injection technique are the best way to avoid these side effects. If you have any concern about side effects, please consult your plastic surgeon. How does botulinum toxin work? Botulinum toxin is injected into muscles and works by blocking nerve impulses in the injected areas. This reduces muscle activity that causes facial wrinkles. When can I see results from botulinum toxin treatment? You may see an improvement within 1 to 3 days after injection. It continues to improve, and the significant results show up 1 to 4 weeks later. The effects last for 3 to 6 months. Duration may differ depending on the individual and the treatment method. How long does botulinum toxin last? If you are satisfied with the results and want to maintain it, you would get a treatment regularly. Injections may be repeated when the effect of a previous injection has diminished, but generally no sooner than 12 weeks. The best time should be consulted with your doctor. What are the possible side effects of botulinum toxin treatment? The most common side effects are weakness of muscles and appearance of a bruise at the injected site. The side effects slowly diminish within 6 weeks after injection. Other common side effects in clinical trials of botulinum toxin treatments are headache, flu syndrome, eyelid drooping, and nausea. Although understanding of facial muscle anatomy and proper injection technique are the best way to avoid these side effects. If you have any concern about side effects, please consult with your plastic surgeon.